Hello friends, this is Dr. Gunjan Gupta, a dermatologist practicing in Noida since the last 20 years. And today I'm here to talk about basic care of the facial skin. Skin is the largest organ of our body. It is a mirror to the general health of our body. It is not possible to have a healthy glowing skin unless we have a healthy body and a healthy mind. And for that, we need a healthy lifestyle, well balanced diet, adequate hydration, and a restful sleep of 6 to 8 hours. I will not be going into details of these, but will be discussing basic skin care. To understand basic skin care, it is important to know our skin type. Most of us are aware whether we have an oily, combination, normal, or a dry type of a skin. In case of any doubt, wash your face with a face wash and after about an hour, pat it with a tissue paper. If you see visible oil spots all over this face, you have an oily skin type. If they are present only on the T zone, you have a combination skin. And if there are no visible oil spots, you probably have a normal to dry type of a skin. Then there's the sensitive skin type, which burns and stings on application of most products. It turns red on exposure to sun and heat. Also, the skin type does not remain constant. It changes with seasons, climatic changes, it changes with age. As we grow older, our skin becomes dry, especially after the age of 40. Hormonal changes like hypothyroidism and menopausal changes also lead to dryness of skin. Certain vitamin deficiencies like B12 and vitamin D deficiency can also lead to dryness. Then, excessive exposure to heat, sun rays, um, long hours spent in the AC, regular swimming, etc., can also all lead to dryness. Now, once we've decided upon a skin type, we can buy products according to the skin and take care of it accordingly. Because a lot of times, products which do wonders for our relatives and friends and neighbors are not giving the same results for us. This is because we need to use products that are suitable to our skin type. Now, starting with the basic skincare, for those of us who like to keep it simple, it consists of three basic steps, that is cleansing, moisturizing, and using a sunscreen. Starting with cleansing, it is important to use a cleanser regularly. It can be a foam, non foam, soap, or a soap free face wash. Cleansers are supposed to be used maximum 2 to 3 times in a day. Using them more frequently can lead to a sensitive skin. Never use very hot water. Normal to cold water is always preferred. In case you have an oily skin type, look for cleansers which have glycolic acid, salicylic acid, or benzoyl peroxide as their ingredients. Some of the brands that I have used in my practice are you have Ahaglow S, um, you have Saslic DS, Cetaphil oily skin cleansers. These are some of the common brands available in the Indian market. In case you have normal to dry skin, look for some soothing molecules like lactic acid, aloe vera, tea tree oil, etc. Some of the brands that I have used are Refresh, BioCutis, Fash Foam, Cetaphil Daily Exfoliating Cleanser, etc. There are several other standard brands available. In case you have a very sensitive skin type, use non-soap cleansers like Cetaphil cleansing lotion, Immodal cleansing lotion, and Moist cleansing lotion. These have cetyl and stearyl alcohol and are soap free. Also, people who like to use home products, the people with oily skin can use besan, multani mitti, etc. once in a while as these absorb the excess oils. For people who scrub, it can be done once in 10 to 15 days in case you have no active problems on the face. More frequent scrubbing can lead to sensitive skin. Toners are not mandatory. Only people with very oily skin can use toners, and even in that case, non alcoholic toners are preferred. Coming on to the next step, moisturizing. Moisturizers are also very important for all skin types because moisturizers help hydrate the skin and retain the moisture. They improve the texture, elasticity, and the suppleness of the skin. Only oral intake of water does not suffice. The common molecules found in most moisturizers are ceramides, oatmeal complex, you have glycerin, lecithin, hyaluronic acid, then you have those cocoa butter, shea butter, mango butter, etc. The more thicker and inclusive moisturizers might contain beeswax, mineral oils, and white soft paraffin. Some of the moisturizers contain special ingredients like vitamin C and tocopherol derivatives. Others might have herbal extracts like aloe vera, tea tree oil, you have chamomile oil, allantoin, etc. So moisturizers need can be cream, lotion, or gel formulations. They can be water-based or oil-based. Generally, the day care moisturizers are a little lighter as compared to the nighttime formulations. For oily skin type people, it is preferable to use light water-based preparations, and those with dry skin can use thicker, creamier preparations. In general, it is advisable to use paraben free, PABA free, non comedogenic products. Moisturizers can be, as I told you, cream, lotion, or gel based. You have gel based mostly for acne prone skin. Some of the moisturizers that I have used in my practice are for oily skin, you have Moisture Wave lotion, Episoft AC, Emoline, Acrofi, you have Ifatop PE lotion, etc. And for normal to dry skin, you can use Biosilk, BioCutis cream, you have Moisture Wave cream, Dew Soft, etc. Venusia. For acne prone skin, you have Acne Moist gel, you have Zit Moist gel, Acne OC. For very sensitive skin, non perfume products like Cetaphil moisturizing lotion and Physiogel are available. Certain international brands available are Cetaphil, CeraVe, Aveeno, Avene range of products. Bioderma again is also good. Myoderma Neutrogena is also commonly available international brand in Indian markets. Uh, Moisturizers need to be applied after washing your face, pat it dry, apply a thin layer evenly. It should not be overused. Your face should not feel sticky. Note of caution for people with very sensitive skin types: do not use very hot water, do not use regular cleansers, go for non soap cleansers. No toners, no scrubbing, only sheet masks are allowed, and non perfumed moisturizers. Even herbal products or those so called natural products can cause allergies. For example, people react to honey, papaya, aloe vera also. So be careful about what you put on your face. Coming to the final step, and that is the use of a sunscreen. Sunscreens are very important as sun is the single most important cause of photoaging, visible in forms of fine lines, sunspots, uneven skin tone, tanning, etc. If you wish to delay the development of these changes in your skin, you should be using a sunscreen all through the year. Sunscreens are important to use indoors as well as outdoors, because a lot of studies nowadays have proven that long hours spent under a brightly lit tube light is also the light from the visible light from the tube light, the screens also is contributing to photoaging and pigmentation. While selecting a sunscreen, you need to keep in mind certain things. The first and foremost is the SPF factor that indicates protection provided against UVB rays. An SPF of 15 provides protection of 93% and an SPF of 50 provides a protection of 98%. In short, doubling the SPF does not double the protection value. Anything around 30 is good enough for Indian skins. Second point is the boot star or the PA rating. 3 and above is considered good. It is the indication of protection provided against the UVA rays, which are responsible for the uneven skin tone, tanning, etc. PA rating, and then you have the IR protection, that is the protection provided against the visible light. As I mentioned earlier, your laptops, cell phones, tube lights, etc. emit visible light, which is also playing a role in photoaging. And hence, In case you're spending long hours in front of a screen or in a brightly lit room, you need to have a sunscreen which mentions that it is providing protection against visible light. Fourth is the base of the sunscreen. It can be a water-based or a oil-based sunscreen. Again, the formulation can be a cream, gel, or a lotion. Some of them are silicone-based, which have a little plumbing effect on the skin. Sunscreens for dry skin will be more moisturizing in base. For those meant for oily skin, will be water-based light preparations. In case you're spending long hours outdoors, you need to use a waterproof sunscreen. In case you're spending long hours in the AC, you need a matte finish. Apart from these, the sunscreens basically contain physical as well as chemical sun protective agents. Most of the adult preparations available are a combination of both these agents. Purely physical sunscreens are considered safe for children, as the ingredients are not absorbed, they merely reflect the sunlight. Some of the sunscreens that I have used in my practice are um, most of the companies have a range of products suitable for different skin types. So you have multiple preparations in each product, each company range. For example, the Rivella range, Rivella Light, Rivella Tint. Some of the sunscreens are tinted, which give you the look of a makeup and help you in avoiding multiple layering on your skin in summers. Then you have the Suncross range, Suncross Soft, Suncross Silk, Suncross waterproof sunscreen. You have the Neutrogena sunscreens. You have Photostable Gold, Photoban, Sunban Matte, etc. Some of the international brands are Cetaphil All Day. Then you have La Shield, Heliocare range of sunscreens, etc. So you have several preparations available in the market. You'll need to use a couple of sunscreens before you're able to decide which one suits you the best. This basically completes the morning routine of most people. Some of you like to use makeup. In that case, invest in good quality products. Do a test batch behind your ear, as most expensive products can also give you allergic reactions. Coming to the night care routine. Night care, first and foremost, remove your makeup with a makeup remover or micellar water. Then wash your face with your face wash, pat dry. Now is the time to apply your night repair formulations. For younger population, around 20 to 30 age group, a simple moisturizer is good enough. Some of you would like to use moisturizers with special ingredients for brightening of your face, for example, vitamin C, niacinamide, arbutin, etc. For an older population, it is advisable to use special formulations which help in the repair of the skin. Most of the nighttime formulations have common ingredients like vitamin C, vitamin A derivatives, tocopherol or vitamin E derivatives. You have soluble collagen, hyaluronic acid, certain anti-aging molecules like coenzyme Q10 and other anti-aging peptides. Broadly speaking, there are two different categories: vitamin C preparations and vitamin A preparations. Vitamin C can be used by all age groups. The preparation should have a concentration of at least 8 to 20% of vitamin C for it to be effective. The pH should be between 2.5 to 3.5. It can be a lotion, cream, gel, or a serum. As liposomal preparations, liposomal technology is used in some. Serums have very high concentration of ingredients and the particle size is very small, hence it is considered to have a better absorption. Some of the common preparations available in the Indian market are Regiglow C20, Stria C10, you have VCX and VC15 by Cipla, you have Flavo C by Orega. Then you have the international brands like Obagi Vitamin C, Sesterma Vitamin C, etc. The vitamin C preparations might sting a little. To avoid that, you can apply it on a damp face. Again, the next is the vitamin A derivatives. These are the most common ingredients of most OTC as well as prescription anti-aging creams. They can be in the form of retinol, retinol esters, retinaldehyde or retinoic acid, which is the most potent form. The OTC preparations generally contain milder and lesser concentration of vitamin A derivatives as compared to the prescription anti-aging creams. These prescription anti-aging creams can be more, since they have more higher concentration, and they can be more irritant also. Be careful of how you use them. They're used very sparingly, only at night. In case they cause dryness, you can alternate it with a vitamin C preparation. And again, as I mentioned, most of the creams and formulations have hyaluronic acid, soluble collagen, and other peptides along with the vitamin A derivatives to lessen the irritant potential. Some of the common preparations available are Stria A15, UGuard, EGA, the Rock range by Johnson and Johnson, Retilift, um, vitamin A cream by Reti H by Sesderma, etc. So these are the nighttime formulations, and that completes your skincare regime. Before I finish, it is important to stress upon the role of diet. Without a healthy diet rich in vitamins, minerals, iron, and protein, it is not possible to have a glowing face. Anemia is the commonest cause of dullness. So, try and include lots of fruits, colored vegetables, nuts, berries in your diet. They're all rich in anti aging molecules. Also, stay away from high glycemic diet that consists of sugars, sugary colas, then you have white breads, fried food, etc. Thank you so much.